Now we will talk about somatic therapy for the people who survived torture. I watched the first webinar of Inke using methods of Peter Levine for professionals. There was some practice there, so maybe today we will also do some exercises for self-regulation. So be prepared for that, for touching yourselves, but that's going to be nice. And self-regulation is always good. Inge, over to you. I'm ready as well. It is nice for me to be with you. It's good to speak after Monica, my colleague, because a lot of things that I will need to say today will continue from what she said. I will start by saying something which was a very important question for me when I started working with trauma. Trauma has been with us as long as there have been people. Gordon Anderson found evidence of trauma in Mesopotamian texts of 3,000 years ago. Trauma also has a huge role in literature. There is an idea that Odyssey that explains how a warrior comes back from war is very similar to what people feel when they come back from war or captivity or torture. Torture has also been with people all the time. So if we deal with torture and the consequences, and we have had that for centuries, why do we know so little about trauma, both the therapists and the society? Why are we still looking for effective forms of trauma therapy? And even after such a long time, people don't know everything about traumatization after violence and how we should treat people with such experience. These questions will lead us to some history of research and treatment of trauma, and we may find explanation there why our attitude towards trauma, our understanding is not enough, and what we can do to improve our understanding. European research on trauma starts in the end of the 19th century in Saint-Étienne Hospital in Paris. And the first people who started working in psychotherapy described hysteria. And they said it was the result of violence that these people had gone through, especially sexual violence. Jean-Marie Charcot and Pierre Genet and Sigmund Freud, who had a scholarship with Professor Charcot, published their works on that topic. Yet in 1906, Freud decided to abandon his previous theories about sexual violence as the reason for neurosis. He developed a theory that was almost opposite, saying that memories of sexual violence in childhood were fantasies rooted in envy to penis and the unconscious desire to seduce the father. From that theory that talked about fathers, uncles, it was easier to do a career in patriarchal Europe, poor Europe in the beginning of the 20th century. This shift made an end to discussions of trauma. Psychoanalytical paradigm that dominated the scientific discourse and then therapy for the 20th century was not trauma-oriented and was not developing a therapeutic approach towards trauma. And as a result, there was no progress in this for a long time.
Після Першої та Другої світових воєн травмовані
During the First and Second World War, the traumatized personnel and prisoners of war suffered again, and they came back home, and once again it became understandable that applying violence causes serious disruptions both in the mental psyche of human and their physical health. However, broken men could hardly count on any help that would come from the then-time European societies. Russian, Anglo-Saxon, and Soviet strict approaches condemned instead trauma as fatigue, cowardice, and weakness. And there were some fears that soldiers instead would take advantage of false, invisible wounds in order to gain pension payments. All of this was not fostering social recognition of trauma. Even nowadays, there is skepticism in places with reference to whether or not the people who are coming back from war and captivity are suffering that much. Since the 1920s, in the 1920s, there was also a trend to determine everything that looked like a breakdown of personality as schizophrenia and to treat that with medication. Therefore, nowadays, it's a prevalent conviction in places that people with mental frustrations and disorders have to be treated with psychotropic medication. A lot of patients keep coming and they are willing to take a pill or a tablet that would turn them into humans that they used to be before the war. However, there are no pills like that. Medication indubitably can provide temporal relief and enable these humans to feel quite safe and secure in order to start therapeutic work on this trauma. Pharmacology, however, cannot cure the root of the problem. Observations by Van der Kolk and some others say that in many cases PTSD medication is not helpful at all. In the mid-20th century, behaviorism focused the attention of the society on people's behavior after trauma infliction, and different types of behavioral therapy came about, which are still being utilized today. Cognitive behavioral therapy is focused on recognizing and evaluating one's own behavior patterns and settings which are at the foundation and the basis of such behavioral patterns, and the idea of the fact that a trauma can be overcome, can be overridden with the help of reflections, meditations, thinking over, is still common among many people. However, a lot of traumatized people deem that narrative therapy isn't helpful much because symptoms are not changing even when people have the full cognitive perception of what has happened to them. We are looking back to the history where trauma was ignored, devalued, were brought down to different wrongful behavioral patterns, or made stupefied with the help of different medications. That means that we have learned a lot during the previous century, which unfortunately prevents us in our proper understanding and treatment of trauma. And in the first place, it hinders the survivors to reach out for help or even hope for improvements of their health conditions. Along with that, there is another trend in place, which is slowly changing the paradigm, and that is the appearance and application of somatic therapy. For me, the foundation for the renaissance of studying trauma was made by the Harvard University professor Judy Herman in her work Trauma and Recovery. Her disciple Van der Kolk, who you may know about from the book That Boże Will Remember Everything, Peter Levine, Doug Hoffman, Daniel Signer, and others, continued observing the developments of therapy. At the same time, different approaches of somatic therapy appeared, like MDR, somatic experiencing, which have absolutely different understanding of trauma as opposed to the traditional school. Somatic approaches understand trauma as a reflection or an imprint left by the protective responses or reactions of the body that was unable to complete that reaction because the body was overwhelmed at the time. And at the heart of this center are protection reactions, fight, flight, which are still part in the body and remain in the body when the process is still incomplete. In the next second part of my presentation, I would like to share a bit more exactly about that. And I would like us to start by considering the characteristics of trauma after torture, and then I will explain how the somatic experiencing and somatic therapists work with these particular characteristics. Before that, I took a list of a famous German researcher, Michaela Kuba. Professor Michaela Kuba compiled a list of indicators of a potential heavy traumatization. I was able to see that out of 15 items on this list, 12 are relevant for the experience of torture and captivity. Hence, we can expect a very heavy traumatic reactions if the events continue for a long time. This is a very frequent characteristic to accompany tortures. If they're repeated on a constant basis, and if people are left with different mutilations and maiming, if it's difficult for victims to make sense of everything that's taken place in their lives, and this is also to do with human-inflicted violence. That is to say, this is not a disaster, natural disasters that violated against people, but people violated against people. And also if the victim feels an accomplice, especially if this is to do with sexual violence. In many cases, we know that there is sexual-related violence to do with the conflict. Sadistic torture is another element of that. If several attackers violated against a survivor, and if the survivor had very serious dissociations, and if no assistance or help was provided immediately after the sexual attack, and if no one spoke about this crime with the victim or the survivor. So if we make sense of these set points of these items on the list, we get to see that they are not only cumulative, but they are also interrelated, which means that we are fighting not just one characteristic, but we confront all of these linkages, all of these complex linkages, and all of these links and linkages can be very, very complicated for therapists to deal with, as well as for patients and their family members. I would like us to dwell on 3 points and to show how somatic approaches enable therapists to cope with these characteristics and these linkages. But before that, we need to dig deeper into these three items. The first of which was taken by me from the list when there is violence committed by several violators. As a rule, it's always much harder to deal with such an incident as opposed to violence committed by one perpetrator. The opposition to several violators is a prevalence force which immediately activates the nervous system, which means the nervous system immediately makes sense of the fact that there is no opportunity to escape or fight. It freezes and it dissociates just to protect itself and survive. The consequences of being inflicted by such violence and feeling the destruction by such violence is usually the deep, stable dissociation and the feeling of helplessness experienced by the victim or the survivor. The survivor may feel that they are branded, stigmatized forever, and these are irreversible changes for the better that will never go away. Something that distinguishes this person from all the rest who have not survived this experience. Dissociation and freezing protect the survivor, the affected individual, even after the incident. However, it also prevents such people to contact with their own body, their own feelings, sensations, as well as make contacts with other people. Monica has already referred to that in her presentation. The dissociated client may be perceived outside as a very reserved, unemotional, disaffected, maybe even arrogant individual, or even can come across as apathetic, cynical, disinterested individual, and then, for the least reason, this person may be easily aggravated and made angry and acting reactively. One of the biggest problems in the area of traumatic sensitivity to trauma is that the people who are at the point of post-traumatic responding, the motor reactions is perceived by the surrounding as something completely unacceptable and threatening at the time when it takes place. Somatic therapy distinguishes all of these characteristics, identifies them in conscious and unconscious actions to protect the body and their own system from different possible assaults and attacks. Our Center of Phoenix, at its trainings and webinars, aims for people to recognize all of these symptoms of trauma, both within themselves and in the others. If we can distinguish the symptoms of trauma, then we can behave around other people in a much more quietly, warmly, genially, and with greater empathy. Within somatic therapy, these systems are regarded as a gateway, which shows us the way to the trauma. It's important for the therapist to remain inquisitive, stable, emotionally, and wouldn't allow for the helplessness and suffering of other people to draw themselves down into that load. Now let me mention the second point. Deep dissociation also is heavily to do with sexual violence. Violence is sexualized when it is directed exclusively at gaining power, and sexuality is used only as a tool, as an instrument. Sexualized violence in torture and captivity is aimed at destroying the identity of the individual. That's why it's very difficult to live through that. The level of dissociation after the traumatic experience is over is extremely high, and sometimes it's impossible to speak about it because the story itself is so painful and is burdened with shame. Somatic experiencing is a form of therapy where the story of traumatization doesn't play that much of a role. If I need to know what has happened in order to work with the patient effectively and efficiently, we can begin working in the area where the patient can work, feels able to work. And for the majority of patients in this at this association stage, it may be a very narrow window of opportunity, just a small point, and based on this point, we can already start work. You may all know that shame does not disappear when the clinicist says, don't be ashamed. No, because this shame is also very heavily connected with the feeling of helplessness, which makes the client feel possessed by shame when it feels like there is no way to relieve this shame, this captivity. Somatic experiencing instead allows you to feel shame at the same time not feeling low, not feeling depressed by it. So pendulum kind of stages between shame and the opposite feelings. For example, this patient can find a pathway to recovering their own dignity. It's like a pendulum movement, swings of pendulum. And along with that, torture experience is accompanied with a feeling of guilt. People who feel innocent victims of interpersonal violence, as usual, survive their trauma much better as opposed to those who feel accomplices in committing such violence. Often, during tortures, the victim is made persuaded that they are responsible for this violence. So this torture can also have an element of applying violence against others. So this is a very common, widespread practice in torture. Somatic therapy distinguishes between guilt and the feeling of guilt. The feeling of guilt is much closer to shame than guilt. It's diffusal, depressing sensation of failure and disgrace, lack of dignity, which can hardly be resolved directly without someone else's help. Servana has written about a client who refused to take a pill because it was like betrayal of his combat brothers who died in the battle. His physical suffering, this client's physical suffering symbolized remembering, commemorating, and commitment to the suffering experienced by his fellow combatants. The traditional approaches would regard this as a stalemate or a dead end in therapy. You may have a therapist saying something like, if he is unwilling, you cannot do anything against that. But somatic therapy
знайдує в цьому такі якби дуже цікаві сигнали, які нам кажуть, що зробити.
still finds very interesting signals that enables us to understand, yes, it can go through that. So there is a very specific need for us to understand that the sufferings of the combatants have to be recognized and appreciated. Of course, this was very much important for this patient that Vanderpoort was working with, and this need is matched with the responsibility for the society to see and recognize those people who have died in the battlefield. For them, it means that if the society fails to do that, so these people themselves who are suffering, they will feel failed. So somatic experiencing is offering a range of different activities that can be used in order to commemorate the memories of those people who have died in active service, in order to separate and deprive the body from the feeling of guilt and responsibility or liability for that. Such seminars, which are dedicated to the topics of guilt and shame, the feeling of guilt, quite often these ideas, they seem to be like a barrier for treating the trauma. They have to be overcome before we begin to deal with the trauma. We have to get rid of this shame, embarrassment, and the feeling of guilt. Now, item 3. After sadistic torture, we have not only the expressions of horror, helplessness, and disgrace, but Mikhaila Kuba writes that those who have embraced part of the behavior and the way of thinking of a criminal, interjected that into themselves, quite often goes through intensive internal recreations, reenactments of the experiences when victims are suffering, being tortured. This is an eternal engine of memories and imaginations, which is not only highly stressful, but also extremely disgraceful, which is why it's very difficult for victims to talk about that.
This is what they feel inside, but this is also what can be seen from the outside. 135 years ago, Persian said that if you do not see the trauma consciously, you will have to relive it. Now we would say if you're not conscious of your trauma and try to reject that, you will have to relive or process it, rework it. But this reliving or reworking doesn't mean really truly processing that properly, and that's why it keeps continuing. Somatic therapy means discharging the energy that was mobilized in the body during the violence that people went through and during periods of being frozen. This is done very carefully to make sure that the patients are not overflooded and they are not taken back into the whirlpool of trauma. In somatic experience, we compare this process with titrating acid in foundation's solution. If you add this to chemical substances at the same moment very quickly, you can get a very vivid chemical reaction. Same happens with the body. If we release this embedded or bound energy too quickly or too fast, and then traumatic energy is released in a controlled way and gradually, a patient's body is not overwhelmed, and this reaction, this release, can look like trembling, micro movement, crying, being too hot, but the patients can sustain it and they can integrate that at that moment. This slow dosed release of energy in these extreme situations is the base for trauma therapy, somatic, in our somatic practices. When all of the defense reactions that were not completed are completed, and the energy of survival has been released, the trauma is resolved, and the symptoms that were provoked by this trauma, they disappear. And sure, this is just one of processes for one trauma. You can't use one process to solve and integrate all of the traumas. It's a long process. Due to controlled, dosed release of traumatic energy, old traumas can be integrated as well and overcome in a short period of time. But the patient must be able to do it. That means reflecting, feeling quite safe to work with a therapist, to feel safe at the presence of a therapist. To reach that, one may need a lot of time. So somatic experiencing pays a lot of time, more time than usual, on creating conditions to overcome trauma, while the integration itself does not usually take a lot of time. First of all, those who suffered have to bring curiosity rather than the desire to be over with that quickly. Therapists also need to be curious and have the ability to contain, to maintain, to go through. Well, this is the thing we call containment. And then you need instruments, working techniques that can be suggested for the kinds of therapies that we use. Phoenix and Libereco suggests that doctors, case managers, other specialists try somatic techniques and integrate them in their work. Together with the Forest Blade, we are trying to improve their qualification and their skill of treating trauma, and especially the trauma that people have after difficult war experience and torture. 3 things are needed for that: somatic trainings that would account for trauma, where people from the healthcare sector can find new instruments by using somatic techniques. Second, these are the projects that help you use somatic methods in rehab centers, veteran associations, and other institutions. Number 3, it's having professionals interested, curious, and then consequently have decision-making, political decision-making to really improve the situation and support the use of somatic techniques. What we do now and my presentation today are focused on that. Thank you for your attention. We are also so very grateful to you, Imke. Just a couple of minutes of your time, can we do that? Imke, hi. I wanted to say, if you don't need Imke, she is a very unusual person. She's a specialist. She comes from Germany, but she learned Ukrainian in less than a year. Of course, she speaks German, she speaks English, at all of the international summits, but she said here in Ukraine it would be easier for me to speak English, but I will speak Ukrainian, and she speaks great. Thank you, dear. Ksenia, you won't believe it. I was just going to say, Imke, how perfectly you speak Ukrainian. Can you just, well, say something for us in this respect? I understand you're German. You use English at international forums, but you speak Polish. How many languages you know?
Ну, мені здається, що плавно я говорю на
I think that I can speak 7 languages, I guess, 6, 7, and that's smoothly, free. But just some basic communication, 10, 12. Wow. It's most important that we understood here. You know the language of body, you know about this bodily experiences. I promised the people we're going to have an exercise that they will be able to take with them. Maybe you can give us some small tool, something from somatic experience.
Можливо, ви знаєте, якщо ми працюємо з людьми з
You probably know that if we work with people with very strong trauma,
лікарі та психологи
some doctors and psychologists, and then people who document war crimes. There are many situations when we can feel that we are in pain. We really relate to what people say, to how they look. We resonate with the story of a person. Here, it is very important not to really fall into the suffering. We don't want to get ourselves into the whirlpool of other people's trauma. We want to be stable, regulated.
І до того допомагає, так, що ви просто рукою
What can help you is this. Put your hand here. And you tell me it was not happening in this body, meaning in my body, just to stabilize your borders. You will continue being empathic, but this is how you separate yourselves. You avoid getting too close. By this, you show this is my body and that is another person's body. That was not in my body. It was not happening in this body. I do it every time after I work with people, so as I don't take with me everything that my body received, so that I'm free and clean when I start working with my next client. It's just very simple. You just touch yourself here. That was not happening in my body. That was not happening in this body. And this is enough. This is enough to understand, and you also embody that experience. Embody the fact that my body has different history. Thank you.